Hey guys, my name is Makara Mooney. I go by Mac or Kara. I actually just recently got the nickname Mac. When I started my job, no one could pronounce my name, so Mac just kind of stuck, and we've gone from there. I grew up in Sheridan. I went to school there, graduated from Sheridan in 2016. I have a large family. I have 4 sisters and 1 brother. The ages range from me, the oldest, 24 almost, and then it just turned 8 in December. I kind of wanted to do a little background on why I wanted to become a nurse. So my grand was diagnosed with cancer 10 years ago, and I was very young at that time, but I did get to watch her go through chemo, her go through radiation. I got to see how the nurses interacted with her and just kind of how the cancer process took a toll not only on her, but as a family as well. Since then, I just kind of knew that this was my calling. Even at the young age of 14, I knew that this is what I wanted to do. So I actually started college at Henderson in 2016. I was there for 2 years. I was in Alpha Xi Delta, and I was vice president and then president before I transferred to Baptist Health College Little Rock, where I started my associate's degree. I graduated from Baptist in December of 2018, and I passed the NCLEX the following month, and then I started my job as an oncology nurse at Baptist Health Little Rock. I absolutely adore my job. It's exactly where I wanted to be since I knew I wanted to become a nurse, and I truly feel like I found my calling. But recently, since COVID has struck everywhere basically, we are now half hospice. So, I didn't really sign up to be a hospice nurse, but I have learned so much about just how you take care of a hospice patient, how do you interact with the families, and just having that opportunity to learn more things about nursing. I will definitely be able to use that in my future nursing career. So I have 4 dogs. I have 3 Australian Shepherds and a little mutt, but we think she's a black-mouthed cur. Anyways, so it's Ellie, Hattie, Havoc, and Trip. They are my little kids. But anyways, so the reason I decided to go back for my BSN is because my long-term goal is to be a family nurse practitioner. So hopefully, I can get through this with flying colors and then move on to a master's program. Okay, so on to nursing research. So nursing research, in my own words, is finding evidence on issues that are important to nurses and how it affects our patients. I feel the role as a nurse in research is to figure out ideas and solutions to problems we see firsthand regarding our patients. We run into a lot of issues on our floor, like bed sores and, oral care and stuff like this. And seeing this firsthand, we can create ideas and possible solutions to promote and do better. I also think it's important to advise the clients to participate in certain studies that could benefit them in the long run. Even if it's just a study right now and we're, obtaining evidence, I feel like if it can pertain to them in any sort of fashion and help them in any way, I think we should advise them to participate. I feel the role of a nurse in research related to ethics is promoting the patient's autonomy, maintaining privacy, and being respectful when conducting research. This is like one of the foundations as a nurse is the code of ethics. So I feel like this is super important to use when you conduct your research. I feel like it should be, one of your top priorities as a nurse and continuing, doing your research, but also maintaining their autonomy and providing, as much privacy as possible. I think nursing research is important because it continues education in the nursing profession. So starting out at Baptist, you have to be in a 6-month residency program. And in one of those, in the class that you have to make a project, and it's like an evidence-based practice. And so one thing that we did in my group, we were talking about how telemetry monitors should be worn on cancer patients. Now, the reason we did this is because we've noticed, and we did research, that a lot of our cancer patients receiving chemo have a lot of cardiotoxicity effects. So it is very important for a chemotherapy patient to be wearing a cardiac monitor at all times, so we are aware of what the heart's doing consistently. And if something were to change, we can immediately know that and treat it as needed. So I think that is why we should research these things, because now we use cardiac monitoring 24/7 on our chemo patients, and even a few days after that, because we don't ever know how the chemo is going to affect the patient. So, and I also know that nursing in general is always can change. So it's always important to educate yourself and research as much as possible to keep yourself educated, and that way you can educate your patients as well. So from my reading, I identify most strongly with the positivist paradigm. I believe this because I think me being at bedside, I can observe a patient, I can measure some things, like measure an outcome, and I can observe something. If I can see a factual, this happened because this happened, I feel like I can learn the best way that way. A lot of this positivist paradigm is hypothesis. So if this, then this. And so I feel like I learn best way like that, with that mindset. And I definitely feel like you gain factual knowledge with this mindset. And so I just agree mostly with this because of those reasons. Thank you for watching.